Greetings everyone. We are going to present about Positron Emission Tomography, commonly known as PET.
We are from Group 14 and today we'll be presenting our slides about medical application diagnostic imaging about positron emission tomography, PET. My name is Avinesh and I'll be doing the introduction about positron emission tomography, PET. Basically, it's a scanner that is a nuclear medicine imaging technique which produces a three-dimensional image of picture functional processes in the body. The system detects pairs of gamma rays emitted indirectly by positron emitting radionuclide or tracer, which introduced into the body on a biologically active molecule. Images of tracer concentration in three-dimensional space within the body are reconstructed by computer analysis. And next is beta decay plus, which is isotopes which undergo this decay and thereby emit positrons, include carbon 11, potassium 40, nitrogen 13, oxygen 15, fluorine 18 and iodine 121. I'll pass to my partner next.
A very good morning. I'm Aguila. Today I'm going to present about the safety precaution measures to be taken while handling the PET. All PET laboratory personnel are required to wear radiation measures when working in the facility. Second, eating, drinking, smoking or application of cosmetics is not permitted in the laboratory areas or the scanner room, and no drink and food storage is permitted in the radiation area. Next, radioactive materials with substantial radiation levels will be handled with tongs and transferred and stored in approved shielded containers. Other than that, all personnel exposed to radioactive contaminations are required to monitor their hands, feet and clothing before leaving the contaminated area. The staff should maximize separation from the patient after injection and minimize the time spent with them. Finally, use of cart to transport the dose from the hot laboratory to the injection room will increase the separation between the technologies and the shrink and reduce the dose if the transport time is significant. Thank you very much, and I'll pass it to my friend to continue further.
Hi, I'm Dinesh Kumar Pandian.
Now it's time for the history. Where does this positron emission tomography started? Firstly, it started at Massachusetts General Hospital in Boston, in USA, in 1953, which was founded by William H. Sweet and Golden L. Brownell. These two guys has published their first newspaper ad about this positron emission tomography, which was titled as Localization of Brain Tumors with Positron Emitters. This is the first positron emission tomography which was founded in Massachusetts General Hospital. The first PET scanners had small number of radiation sensors to build the image, and they could do only a slice at a time. The slices are very thick. Thus the image obtained with this PET had a low quality, so it was impossible to get the finer details of localization of function in the brain tumor. So their clinically usefulness was quite limited as compared with modern models which are available now. That's all for the history of positron emission tomography, and we will continue with the other topics.
Very good morning. My name is Samuel, and I'll be explaining on the latest update on development of PET. The latest development in the area of PET detectors aimed at improving spatial resolution and sensitivity, such as lab R3, which may improve the signal to noise ratio in whole body PET, or could even be used for time of flight PET. A system, MedPack 2, which is under development in lab, nuclear medicine clinic, addresses two new technologies in animal PET. First, the use of avalanche photodiode arrays to read all small individual LSO crystal with 1 by 1 scheme. The second one is 2 radial detector layers for depth of interaction measurement. Each layer will consist of 4 times 8 APD matrix and 32 LSO crystals, yielding a front layer, back layer informations. The third one is integrated 16-channel preamplifiers and 4-channel integrated constant fraction discriminators. The second one is I'll be explaining about the cost on the technology. Changes in regulation and improvements in reimbursement have propelled positron emission tomography into clinical use, making it increasingly important to understand the cost of this emerging service. The example of cost analysis table are shown here.
Okay, good morning sir. My name is Raj Arvind. Today I am going to present about the application of PET in Malaysia. The PET we've compared to fusion, where the PET or CT fusion images has emerged as a powerful diagnostic tool in the management of patients with lung cancers. The PET for staging and evaluation of response to treatment in patients with Hodgkin disease. The PET scan measures important body functions such as blood flow, oxygen use and sugar metabolism to help doctors evaluate how well organs and tissues are functioning. The PET scans are commonly performed to diagnose cancer, to determine if the cancer has spread to other organs or tissues, to monitor cancer's response to treatment. The results may indicate if an infection is present, if there is a change in organ size, location or shape, if cancer is present or has spread to other organs or tissues, or if there is a problem with the functionality of an organ. The research on PET in Malaysia, where the MOSTI together with Molecular Measure is planning to establish a high capacity 30 megawatt cyclotron facility equipped with positron emission tomography and single photon emission computed tomography capabilities with associated research laboratories, first multi-purpose cyclotron facility in the country. It can further expand Malaysia's capability in producing positron emitting radioisotopes, which can be used in various applications such as medicine, industry, environment and agriculture. Development of positron emission tomography, beta amyloid plaque imaging agents. Okay, then talking about the development of PET in Malaysia, the combined PET or CT scans provide images that pinpoint the anatomic location of abnormal metabolic activity within the body. The combined scans have been shown to provide more accurate diagnosis than the two scans performed separately. Greater detail with higher level of accuracy because both scans are performed at one time without the patient having to change positions. There is less room for error. In addition, manufacturers are now making single photon emission computed tomography and positron emission tomography computed tomography units that are available to perform both imaging exams at the same time, and imaging technology but not readily available at this time is PET or MRI. Nuclear medicine procedures can be time consuming. Newer equipment is available that can substantially shorten the procedure time. Okay, the nuclear medicine examinations provide unique information including details on both function and anatomic structure of the body that is often unattainable using other imaging procedures. Nuclear medicine is less expensive and may yield more precise information than exploratory surgery. By identifying changes in the body at the cellular level, PET imaging may detect the early onset of disease before it is evident on other imaging tests such as CT or MRI. Dual energy and multiple modality configurations enabling component fraction measurements on multi-phase systems of gamma ray transmission tomography methods. Tomographic methods are also being implemented in permanently installed gauges with a limited number of projections, a prior information and parametric description of the process rather than reconstructed images. Okay, thank you.
Thank you for watching this video. Hope you liked it. Thank you.